Good afternoon, everyone. Welcome to the Innovative Benefits webinar series, Helping Employees Use Health Benefits Wisely. My name is Cassie Wade. I am the Vice President of Youth Worker Wellbeing here with Indiana Youth Institute. Thank you for being with us today for today's webinar. We are very, very grateful for the chance to connect with you today as a community of Indiana's youth workers committed to meeting the needs of Indiana's youth. For those of you that aren't familiar with Indiana Youth Institute, our mission is to improve the lives of all Indiana's children by strengthening and connecting the people, organizations, and communities that are focused on kids and youth. Today's session, so just to give you a rundown of our agenda, we're going to start with introductions, housekeeping to help with today's session. Then we'll jump into our topic, helping employees use health benefits wisely, presented by Purple Ink. We'll have some time for Q&A, followed by information about no-cost resources provided by the Youth Worker Wellbeing Project to support your team and improve organizational well-being. And then we'll wrap up with session evaluation. If you haven't yet heard, the Youth Worker Wellbeing Project is a collaborative statewide effort to improve the lives of Indiana's youth workers so that you can effectively work with Indiana's youth. And the success of this project is built on the foundation of collaboration. And we are grateful for our partners from Indiana After School Network, IARCA Institute for Excellence, Indiana Youth Services Association, and Marion County Commission on Youth. Before we begin, a few technical pointers that will help you engage with today's webinar. So use the chat feature to send us a message and we can assist you. We've got a whole team of people ready to help you. You can use this feature to engage with the presenter and the group as well. We also encourage you to ask questions using the Q&A feature, and we'll get to as many questions as possible. So you can ask questions along the way, and feel free to also upvote great questions to the top. And at the end of today's presentation, in a follow-up email, you'll receive a link to complete an evaluation. If you haven't yet heard, IYI is a data-driven organization, and we use this evaluation. We frequently review the evaluations of the survey. And so please take a few minutes to let us know your thoughts about the presentation. And if you don't receive the evaluation email, check your junk email as it may have been directed there. And then once you complete the evaluation, you'll be redirected to a certificate of participation. And like many of IYI's webinars, today's webinar will be posted on our website if you'd like to revisit later or also share with others. There's great information to share with other people. We are excited to continue our Innovative Benefits webinar series with our partners from Purple Ink. The series is designed for youth serving organization leaders and human resources professionals to learn about the latest trends in employee benefits so you can have the tools to boost employee retention, satisfaction, and overall well-being of your employees and of your organization. Our presenter today is Jody Curtis, founder, owner of Purple Ink. Jody has a passion for helping organizations and individuals discover their talents, do more of what they do best, and find joy in their work. She brings a unique combination of prior experience as a CPA, a CFO, and VP of HR. And although she has 30 plus years of experience in HR, she is especially passionate about training and speaking to inspire others. This is evident through her creation of the Joy-Powered Philosophy, which has resulted in the Joy-Powered book series and popular Joy-Powered Workspace podcast. And we're also excited to have a special guest with us, Eric Weigel, as well. I'll turn it over now to Jody.
Thank you, Cassie, and welcome back to those of you who have been a part of the series before. I was your speaker at the June webinar on paid time off, or time off, I should say, not all paid time off. And I'm back again today to talk about benefits. So I want to start with a question about why you should think about working with a broker, which is will be my guest. But before I introduce to him, I wanted to stress the importance of doing this. And I know many of you might be thinking like, oh, we're too small to have a broker, or it's too expensive to have a broker. And I want to tell you, even though Purple Ink is not a nonprofit, we are similar in size to many of you. So we only have 16 people on our team. Only 10 are eligible for benefits, and only 7 of those participate. So my experience with benefits is similar to many of you and your nonprofits out there as well. I have worked with much larger organizations in the past, and really everything I've learned about benefits over the years has been taught to me by benefit brokers, a lot from our guest today, Eric Weigel. But what they can offer you as a broker is obviously expertise on this issue and market insights, letting you know what or other organizations in your industry of smaller nonprofits, and also in the geographic areas that you're located as well too, because whether or not um, other organizations are similar in your industry, they are competing for talent against you. So just knowing what they're offering and what they're doing, and what might be options for you, can be good to know. With that information, they can obviously offer you more strategic guidance on different options, different kinds of plans. Of course, we hope to give you a lot of that today, but working with a broker can help you be specific information to you and your organization. They also have a significant amount of data analytics, just things like understanding what types of prescriptions your employees might be utilizing. And so are there different things you can do based on that analytics? Or are a lot of people on your plan going to the emergency room for primary care? They, not that they single out specific individual names, but they can look at information that supports that can help you to direct training and education to your people around those topics, which is the next bullet as well. What kind of education do your employees need? They can help with the communication of your plan, of your benefits, of options, of upcoming benefits enrollments. And then they also can provide a lot of technology and innovation that you likely might not be able to provide or pay for on your own, especially with today's audience of smaller organizations. But you can get the benefit of what the broker offers and can and provide to all of their clients as well. So if you don't have a broker, that's one of my first recommendations for you. And of course, we can help you with picking a broker or giving you referrals. And of course, I'll provide you with Eric's information as we go along too. But I want to start by introducing you to Eric, who is the Director of Client Experience with the MJ Companies. The MJ Companies have been, I should know this, Eric, but I know you just celebrated a big anniversary. How many years have you been in business?
Yeah, we're in the business now, gosh, 60+ years. It's been a great organization, actually started by our founder, Michael M. Bill, and now owned by his son, Michael H. Bill, but yeah, we've been around for a pretty long time.
Yeah, yeah. And Eric, I won't tell you how many years Eric has been there. I always kind of cringe when people introduce me and I have on my bio that I have 30 plus years of HR experience. And I always think like, should I say, is that a good thing? Or does that just tell you all how old I am? So I don't know. But anyway, Eric is my go-to person when I have questions about benefits, about the market, about what other companies are doing. And of course, specifically today on how we can address some of the concerns for smaller nonprofit organizations, similar to many of you. So let's first, I want to start by talking about different options for employers employer-based health insurance. And I know too, as a small organization, that it can be important to offer health insurance to your people. A lot of other business colleagues of mine or business owners always are surprised when they hear me say that I offer health insurance to our team. But I know that's a key attraction point for people who want and need health insurance and don't have, well, I guess we all have options now to be on the exchange, but still, we all want to have health insurance and as much as we can have it supported by our employer. So, Eric, tell us for small nonprofits with limited budgets, what are some viable alternatives to just traditional group health insurance?
Great question, Jody. As many people know, traditional plans can be cost prohibitive. While it's still considered what I call a traditional health plan, many people may not be aware of this, but United Healthcare has recently introduced their newest health program called Surest. This is a health plan where members can use an app to be redirected to lower cost providers, and they really only pay copays for procedures without deductibles. Kind of a new concept out there, but it is something that is geared, I'd say, mainly to smaller nonprofit organizations. Anthem is also in the process of creating a similar program, but smaller nonprofits can also explore HRAs, such as qualified small employer health reimbursement arrangements. There's a lot of words there. We call it QSARA for short, or an individual coverage health reimbursement arrangement that we also call an ICHRA for short. These are flexible, they're tax efficient, they allow employers to choose their own coverage. There's also health stipends that are also an option. These are less structured, but easier to administer, especially when budgets are tight.
Nice, nice. And Eric, can you explain how those QSARA and ICHRA, how do those work and what benefits do they offer specifically for smaller organizations?
Yes, QSARAs are ideal for organizations, especially under 50 employees, because you can set up a reimbursement amount and really employees can use that for premiums or qualified medical expenses. They're really submitting, for lack of a better kind of receipts back to the employer for reimbursements. ICHRAs are a little bit better structured because they work for any size organization and offer even more flexibility. Employees can pick their own coverage. They're reimbursed based on the defined rules. So the employer sets up rules around how the reimbursement works. But both help employers, especially nonprofits, control costs and stay compliant without the burden of managing a group health plan.
Yeah, nice. And Eric, I know sometimes smaller organizations and nonprofits are not think that, oh, we, just like you just said, we don't want to mess with having our own plan. We'll just give our employees the stipend of a few $100s a month to help them pay for insurance that they go get off of the exchange or somewhere else. Tell us why that might not always be the best idea.
Yeah, in deciding that, for me, it's really about the balancing of simplicity and tax efficiency, and even what's going to be the value to the employee. As everyone knows, stipends are easy, but they're taxable. There's not a tax-free way to do that. You give people money and it comes through their paycheck, so it's gonna be a tax event for them. Where HRAs require more setup, but they do provide that tax advantage because it's a pre-tax deduction for the employees to engage with those type of programs, and they have greater structure. If employees want choice and flexibility, I would really lean towards more an ICHRA, which might be a win-win for employer as well as employee.
Yeah, thank you for that. And again, please feel free to add questions in the chat if you have questions along the way. We're gonna try to not use a lot of acronyms, but I know there are a lot of acronyms in this world too. Well, and as we talk about this next topic, attracting and retaining through benefits, I mentioned that at the beginning that it was important for me to offer health insurance to my team members. There, I can tell you there are people on my team right now that we would not have attracted if we didn't have health insurance. So it really can open up the pool of candidates to you in a different way. Eric, maybe tell us a little bit more about that, or what else you know about how important is health insurance to individuals?
In my role here at MJ, I interview candidates, and you can imagine this industry is as competitive as anybody's industry. It's huge. Our candidates ask about it, especially those with families. Health benefits, in our opinion, and probably in most organizations, it's second only to salary and income. So offering even modest, well-communicated coverage signals that your organization at least values their employees' well-being. I think that makes a big difference in retention and can set nonprofits apart and other organizations apart.
Yeah. And are there some particular features about plans that really make a big difference to employees?
Yeah, we see that coverages for spouses and children are big, as well as low out-of-pocket costs, accessing preventive care. Employees always want to be able to have routine preventive care covered. They want the flexibility, things such as telehealth are options that are big ones. One that's really evolving and becoming a big topic, and we've seen it since COVID, is mental health services. They are increasingly important also. So it's about designing the benefits that's going to serve, in our opinion, the whole person.
Hmm. Nice. I can tell you again through my own experience on our Purple Ink plan, you mentioned that including spouses and children or family coverage and dependents is really important. That's one for us personally that although we offer that to our people, we don't pay a lot towards that. So that can be an option too, that if you're thinking, wow, family health insurance is expensive, I'm not sure that we can offer that. Well, at least we offer it as an option. We just don't pay a lot towards that. We do pay a lot, or 60% towards the individual plans. So don't let those things scare you away from thinking we can't afford it, right? It can still be some options for you to address. And Eric, you mentioned mental health and flexibility. How can you integrate those into a nonprofit's benefit strategies? Like what types of things have you seen work?
Yeah, great question. We feel that can start with either called telemedicine or teletherapy. Those are options that can either be included in the health plan that really is evolved around mental health parity. We also see nonprofits, small organizations, big organizations really kind of need to lean on what we call promoting their EAP program, employee assistance programs, or free counseling programs. Even some programs are available through states or through local health providers. But the flexibility to prioritize those with the broader plan networks and add that virtual care to support employees across different lifestyles and locations is really what we want to look at when it comes to talking about mental health.
Yeah. I always tell people that an EAP, which is an employee assistance program, is something that might not be used a whole lot, but for the people who are using it, it can make a world of difference. And a lot of times now, and correct me if I'm wrong, Eric, but a lot of health plans have, might be somewhat basic, but do have some kind of EAP plan typically included with the health insurance plan now.
Yeah, especially as I kind of mentioned with mental health parity. That is something that a lot of health plans, or even if you have a disability plan or a basic life insurance plan for your employees, a lot of the carriers can add a free, what I'm gonna call it, base level EAP for employees to have access to.
Yeah, nice. And looking, if you're following the chat, Becky, good answer to Tiffany on ICRA. You nailed it. Someone asked, "What is ICRA?" And Becky uh, answered that correctly. It's an individual coverage health reimbursement arrangement. So that Eric referred to a couple times. So thank you for that, Becky. Okay, so let's talk about educating employees on smart health plan usage. This is also an area that I think is really important. And I can tell you that before I started Purple Ink, I spent 21 years in public accounting. I worked with two different firms and overall was a very highly educated population, right? A lot of CPE or a lot of CPAs, people who understood finances. And I can tell you, very few of them understood our benefits plan. As a matter of fact, I personally think the people who understand their benefit plans the most are the ones who need to use it and the ones who need to be most careful with their expenses toward it. However, I still think there's a lot of information out there. So, no matter what level of education or background or professionalism, I don't think any of that matters when it comes to understanding health plans. So, Eric, what are some ideas for these organizations on helping them educate their employees on understanding their health plan and some effective ways they can get that information to employees?
Yeah, when, so we're talking about the misconceptions, right? So things to worry about. Um,
Well, actually, I realize this slide is backwards from our list. It's on educating employees on smart health plan usage.
yep, okay,
Out of order
we
there.
can absolutely go there, Jody.
Sorry about that.
No problem. Yeah, I think some things to really think about there. It's the initial experience. So it needs to start with onboarding. Um, whether it's a manager, whether it's a leader, whoever at the organization is bringing those new employees in, they need a clear benefits walkthrough. So they need to understand what's covered, how to find providers, if there's a network, what that network is, and where they can go and who they can see. Understand the difference between urgent care versus emergency care. A lot of times that is confusing, where urgent care can be less costly to the member as well as the organization than emergency care visit can be. And then I always like to say, education is just not a one-time event. So you need to follow up with what I call seasonal reminders and simple tip sheets on learning how to use the care just beyond that first day. Um, and you kind of mentioned it earlier, Jody, that people don't really know their health insurance or what's available to them until they need it. And it's almost too late. So if you can be proactive in that communication and sprinkle it throughout the year, I think that's the best thing you can do around education.
Yeah, I agree. Because even if sometimes people don't remember what they're supposed to do, or, I broke my leg. Am I supposed to go to the emergency room or am I supposed to go to urgent care? And which one's the most effective, cost effective? Um, they maybe at least remember to think about or to ask the question as opposed to just immediately going to the emergency room. By the way, I'm not giving you advice on a broken leg situation and where you should go. I just use that as an example. But it it is so difficult to educate people on that when they think when they're enrolling in their benefits plan, well, I'm not going to have any sickness this year, or nobody in my family's going to break a bone, or nobody has had those things in the past 5 years. So I'm sure I won't have it this year. And then we just think I can ignore that information right now when really the best thing we can do is to be prepared and to understand. So, yeah, I think this is one too that goes back to thinking about working with a broker because they can help you with that education and that sprinkling throughout the year. Because most of you, including me, we have full-time jobs that are not about benefits, right? So we're not spending our days learning about all the stuff and thinking what might our people need. Whereas brokers are doing that. I keep using the word brokers, benefit advisors. Is that your preferred word, Eric? Benefit?
We have many titles out there. It depends what day. Consultants, benefit advisors, trusted partners, brokers, agents, you name it, we'll go by it.
Yeah. All right. Thank you. So, okay. Now here's where I got out of order. Let's go back to the question. What should our listeners and participants today really be worried about? And what do they not have to worry about? Because I know we've told them a fair amount already of things that might be jumbled in their minds as it is. What are some key things for them to focus on?
Yeah, so in the areas we've been talking about, stipends, real simple. That you're just gonna pay your employees and pay taxes on it. But when you start looking at traditional health plans, ICHRAs, QSARAs, we've been talking about, since the Affordable Care Act, compliance has become a very big top concern that I think any organization needs to think about. And I almost want to say that comes before the affordability. When I say affordability, I'm not only talking about just to the organization, but also to the employee or the members. Because when it comes to affordability, high deductibles can be very discouraging. So if you do a high deductible type plan, that's going to discourage use. And as I mentioned, nonprofits, small nonprofits, as you approach, if you're not aware of this, the Affordable Care Act put a rule in place of 50 full-time employees. So when you go over that number, then you have to start complying with the Affordable Care Act rules. So that's where compliance comes into place. Also, don't underestimate how confusing insurance can be. Like I was talking about affordability. You just need to keep things simple. Employees need support to be able to use their benefits effectively.
Mm-hmm. Yeah. And Eric, are there some misconceptions that smaller organizations have when thinking about offering health benefits?
I think the biggest one that we've kind of been talking about, that they must offer a traditional health plan. And that is not the case. Like I said, those under 50 don't really have many rules they need to comply with. Those over will. But as we were talking about, the alternative HRAs, whether it's the ICHRA or QSARA, or even the stipends, could be more practical than doing a traditional plan. Also, if you're trying to match benefits that a larger organization is doing, I would not make that your goal. Don't try to compete with size. Try to compete, in my opinion, with the quality of employees you're trying to attract. So make sure that you have clarity, access, and consistent communication. I think those matter more than trying to compete with a large organization.
Yeah. Yeah. And by the way, there's a lot more smaller organizations in the US than there are big corporations, right? So sometimes, your office location might be next to Eli Lilly or a Toyota plant or Subaru, or up if you're up in northern Indiana, some of those big orthopedic companies up there. And certainly they are on some level competition to all of us, but there's a lot of us who are all in the same boat, that there's really more of us that are in the same boat of working for smaller organizations as well too. So, yeah. And Eric, you've mentioned compliance and regulations a few times. How can a small nonprofit be sure they are staying compliant while keeping coverage affordable at the same time?
Yeah, we have a saying, right? I mean, nothing I'm saying is proprietary to the MJ companies. There are many of good brokers, consultants out there. Are they competitors of ours? I'm gonna be honest, yeah, but I respect them. I know they're out there. So if you have a relationship, that's where you need to go. You need to work with somebody who understands this. Like I said, compliance has become a very big thing since the Affordable Care Act. Consultants, brokers, whatever title you want to call us, they can help you structure your plan. They can help you meet the ACA requirements if needed. Like I said, if you're over 50, you're gonna have to pay attention to that and really ensure that your approach fits within your organization's budget, but still provides, like we've been talking about, that value to your employees and associates and their families.
Mm-hmm. Yep. Yep. I am thinking I should have maybe had a polling question in here, but I am curious to know if people could just respond in the chat. How many of you are offering some form of health insurance in whatever kind of plan it is? If we could see in the chat, just a yes or no answer. Does your organization offer it or not? No, yes, 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 a stipend, telehealth. Yes. Through IYI. Yep. Yes. Yeah. So it's telehealth. Yeah, so it looks like most people have some sort of plan happening, which is good to know. So, yes. And although our conversation today might be leading you to a lot more questions than answers, I think I hope that we're helping you think about what questions might you be asking, right? Sometimes we don't even know what to ask, or we think that traditional health insurance plan is our only option out there. So, yeah, thank you. Okay, so Eric, let's talk about one more acronym, which is called an HSA. And maybe you could just start out by explaining to everyone. Maybe I didn't have a slide on that. I guess I didn't. What is an HSA, and when can you offer an HSA and not?
Great question. Like I said, I've been talking about HRA, health reimbursement account type structures. Those are really more employer funded, and HSA now gives flexibility to your employees and the associates. We always kind of call it the triple tax effect. So contributions that you are taking from their paychecks and putting into the account for them reduces their taxable income. The money in those accounts, they grow tax-free. And when they take that money out to use for qualified expenses, they're not taxed on. So that's what, if you've ever heard the triple tax impact, that's what an HSA can do. It's a very powerful savings tool. HSAs have been around long enough now that it's a very common term. It's very surprising if we ever hire anybody. I'm sure you guys hire anyone that they have not heard of it or they've not experienced it in a previous setting or from their previous employer. So especially for those with predictable medical costs, HSAs are really a nice vehicle for people to save money. It encourages employees to contribute regularly, even if it's just small amounts that help. And I know there's a lot of pressure sometimes for organizations to say, hey, we need to put money in there also. Again, that's a fit if you can afford that. If not, just really encourage employees to budget to put money in there for that rainy day fund, because like I said, it will grow over time as whether they use it or don't use it.
Yeah. So Eric, remind us again on that triple tax. So the employer is, and I shouldn't call it the triple tax. It's the triple tax benefit of not paying tax. So the employer's not paying tax, the employee is not paying tax. And then if the employee builds up their account, they're not paying tax on the money growing in the account. Is that the three things?
Correct. And
Yeah.
even so if I take money out there to pay for an X-ray or a primary care visit, I'm not taxed on that money to pay for that bill either.
Yeah, yeah. So it also gives employers or the organization one more option to support the employee. So for example, if you have a plan, but maybe your organization is not able to pay a lot towards the premium, or you decide for whatever reason to only pay a small amount of the premium, you could contribute to the HSA, or you could pay more towards the employer or towards the premium. It's just different schools of thought on how you want to spend your money and help support the employees. So, yeah. Eric, we do have a question in the chat on this one too. Somebody asked, how does an employer go about setting up an HSA?
Great question. I usually go down a couple of different paths with the organization I work with. First, simplicity. Are you working with any banking institution today? If you are, ask them if they administer HSAs. If they do, then that's the simplest way to do that because you're already banking with them. So then you'll just set it up with them directly. You'll do deductions from your employees' paychecks and you'll directly contribute that money into those HSA accounts. If that banking institution does not have an HSA, there are plenty around the state. Here's where I caution, especially smaller not-for-profits and small organizations. Some banking institutions charge a fee. I always recommend passing that fee along to the employee, whether that sounds good or bad. I don't ever recommend to my clients to take on that fee themselves, but I will say a number of credit union institutions typically don't have those fees. So if you don't have a relationship with one of them, you can reach out to them, and they usually are administering HSAs and they don't charge fees for those HSA accounts.
Mm-hmm. Yeah, that's exactly what I do, Eric. We have ours at a credit union for no fee. So, and just remember to have an HSA, you and Eric, again, correct me on this if I say it incorrectly, but you do have to have a high deductible plan.
Correct. You do have to have a qualified, keyword qualified, high deductible health savings account plan. The IRS sets those guidelines every year, what it means to have that. You cannot offer that along a traditional copay plan that most people are familiar with. So it does need to be a qualified plan to offer that.
Yeah, yeah. And I know I'm always encouraging people on my team to, even though you talked about ways you can use the money in your plan, I'm always encouraging people not to use the money in their HSA plan. And I know many of you are working with lower income wages. So if they need that money, that's what it's for. But Eric, tell us about, maybe explain that a little bit better about what should employees know about saving that money versus spending it for all of their medical needs.
Yeah, couple things about the HSA account is, like I mentioned, it grows tax deferred. So if you leave money in there, it rolls over to the following year. It's not a, what we call a use it or lose it type plan. So those funds are the employees. Once it's in there, it's their money. Kind of a standard practice that I've done in my family. If the bill's under $100, I'm just gonna use my own personal money. I'm gonna let that money grow because at age 65, those funds now become available for you beyond qualified expenses. Until age 65, you can only use that money tax-free for qualified medical, dental, prescription, and vision expenses.
Actually, I didn't realize that, Eric, that once you turn 65, not that I'm there yet, but you can use anything? Is that what you said?
Yeah, you can use it for Medicare premiums. You can, it becomes a mini retirement account.
But but only for healthcare expenses?
No,
I can use it to go on vacation.
if it's in there,
I didn't know that. So that's good. Cassie learned something new too. Now, let's go back for a second, Eric. We had a question in the chat where you said you have to have a qualified plan in order to set up an HSA. By the way, I'll add one other thing on an HSA. The HSA is individually owned. So if an employee leaves your organization, they take that account with them. Your organization doesn't have access to that money, or it doesn't fall back to you if they don't use it. So which is a benefit to your people, right? And a bigger incentive for them to contribute to it and to save money in it because it does stay with them. And we've also talked about, HRAs and QSARAs and all this. If you have an HSA or a QSARA, that is, you cannot use an HSA with those. But the question is, how do you determine whether it is a qualified plan?
great question. Hopefully, if you're working with a consultant or broker, they're able to point out if it is or not. Or if you're purchasing one, you kind of mentioned it early on through the exchange or an individual market, the plan itself should be identified as a qualified HDHP, or sometimes they'll abbreviate it as a QHDHP, which the whole thing stands for a qualified high deductible health plan. An initial way you can look at it is there's not going to be any copays because you can't have any what we call first dollar coverage, meaning if I go into emergency room, I need to pay that bill until I hit the minimum deductible. I mentioned earlier the IRS sets minimum deductibles. So for 2026, that new deductible for an individual will at least need to be $1,700, and for family coverage, it'll need to be $3,400. As we sit today, it's $1,650 and $3,300. Unfortunately, that number is usually indexed every year, and it does go up, but there should be some indication on your policy, or your organization's told you about it, or your consultant has pointed out that it is a qualified high deductible health plan.
Yeah, nice. Thank you. Oh, and Eric, are there company pitfalls with HSAs that nonprofits should help their employees avoid?
You're saying pitfalls?
Yeah.
Is that what you asked, Jody? Are there common pitfalls? Okay.
Yeah.
Yeah, there can be, because HSA shouldn't be used like checking accounts. So, like I kind of said, avoid tapping into them for small everyday costs unless necessary. It is there to be used for medical and dental and vision and prescription expenses. But also many don't realize that with many of those banking institutions we were talking about, even with credit unions, once those dollars hit certain thresholds, the individual can invest them. So there's usually investing vehicles within inside that account once they hit those minimum balances. So I really hate for people to miss those opportunities for long-term growth if there are available in those HSAs by using it for every what I call smaller medical expense.
Yeah. Yeah. Great. And there's another question, great question in the chat, which Eric, I'm going to try and answer this myself and then have you correct me because I think I know the answer to this. They said, what if an employee already has an HSA set up outside of the bank the employer uses? So I'll say that kind of in my terms. We use Forum Credit Union for our HSAs. And if an employee comes to work for us and they have money at Chase Bank and an HSA, I used to just say, okay, that's all right. You can keep that money there and I'll make my contribution to Chase Bank for you and to Forum for everyone else. And then I internally made the decision that all of our people need to be a Forum Credit Union. And to be honest, that's to keep it simple for me. So I think the answer is technically they could keep that money at Chase and you could contribute to it, but you can also tell them that HSAs are going to be at Forum Credit Union or whoever. It could be the opposite. You're there at Forum and you're at Chase. And you can tell them that that's the one you're using, but they can roll those together so they could move their money from Chase into Forum. Is that all correct, Eric?
As a business owner, Jody, you can say it more real life. That is 100% accurate. Business owners have the discretion of who they want to use or make those contributions to. And to your point, that employee, if they've got one that's outside of that arrangement that you have set up and you don't want to contribute to it, they have choices. They can keep it there and spend it down, or they can keep it there and pay possibly whatever fees they have, or they can transfer it into, like you said, the institution that you are using.
Yeah. Yeah. So they could just have two accounts
Mhm.
in that manner too. Yeah. Great question, Kimberly. So, which leads us to our next slide of, are there any other questions that we haven't addressed yet? Okay, well, I'm going to keep going, but if you think of something, please feel free to add it into the chat here as we go along. I'll give you our little Purple Ink promo here. If you're interested in receiving our monthly e-newsletter, you can scan this code to do that. We also mentioned that we have a Joy Powered Workspace podcast. For those of you who may be SHRM certified, we do offer SHRM credits for listening to the podcast. And also, we are offering a SHRM credit for today's webinar, which I did not put on. Oh, okay. It will be in the slide deck you receive. Thank you for that, Becky. So it's not in what I'm showing on you on the screen, but it will be in the deck that follows. I can also tell you the code is 25, so 25 dash X as in X-ray, G as in grandma, X again, R as in real, and the number 4. So 25XGXR4. So thank you for that, Becky, too. So there, give you a little plug for our Joy Powered books that we have available through our website at Purple Ink. And we did just release a brand new book, became a #1 bestseller just a few weeks ago, called Joy at Work When Women Lead. It's a book about women, but not necessarily for women. So even if you're a male, you might enjoy the book as well too. This is my contact information if you want to reach out to me directly with anything. However, if you have specific questions about today's topic, I'll also give you Eric's contact information, which might be more helpful to there. So there's his. I showed you the slide earlier, and again, you're going to get the slide deck. So you'll have this information in your email as well too.
Wonderful, wonderful. Well, I'm going to share a little bit more about the Youth Worker Wellbeing Project before you hop off today. So thank you, Jody and Eric, for your time. And before we close today, we want to make sure that you are connected to additional services through the Youth Worker Wellbeing Project. I know a couple of you dropped in the chat, you are connected, so this is wonderful. So the goal of the project is to increase the well-being of Indiana's youth workers. And we do this by supporting you, by supporting youth workers and the organizations. And so organization support include access to telemedicine and virtual mental health services. So as of today, we have 14,000 plus youth workers from 280 plus youth serving organizations across, yes, hearts, from across the state enrolled in no cost access to telemedicine and virtual mental health services. So if you're not yet signed up, we have spots available. And if you are signed up and you need support in getting that information out to your employees to help them with utilization and engagement, connect with us. We have plenty of resources. We also have grant funding available to support youth serving organizations in building community in the workplace and cultures that value each employee's unique identity, where youth workers feel safe, where they feel like they belong, where they're empowered, where their well-being is prioritized. You heard Eric mention this holistic employee well-being. Individual supports include virtual peer supports, what would be 6 days a week, and also the Emerging Leaders of Color Fellowship, where youth workers of color can connect with the network of peers and continue to grow their leadership skills. We are hosting regional events around the state to learn more about the project. If you haven't yet joined a regional event, this is your opportunity to learn about the project. We'll talk about eligibility, application steps, timelines. Again, it's a great way to learn about the project and how our resources and services can help you create a supportive workplace culture. As a preview, we've got grant applications are opening September 2nd. So grant applications are opening September 2nd with 2 new grant categories, and the Emerging Leaders of Color Fellowship application is open now. Here's the schedule of events. So we'll be in Bloomington, Huntington. We're hosting a virtual event, Lafayette, and then Indianapolis. So you can scan this QR code for details or visit youthworkerwellbeing.org. I'll pause so you can scan that QR code. We'll be back with the Innovative Benefits webinar series on September 11th, Financial and Retirement Benefits That Matter. October 9th, legal and identity protection for employees. And then we'll be back in 2026. I can't believe I'm already saying 2026. Oh my goodness. That might be the first time I've said 2026, maybe. Employee recognitions and learning paths are also coming in spring of 2026. So If you aren't yet connected with our outreach managers, please connect with our outreach managers. They are a great a person to connect to open doors to opportunities, to foster collaborations, and to connect to all of IYI's resources. I mentioned IYI is a data-driven organization. For those of you that have already attended multiple webinars, we've reviewed your evaluation survey. So we thank you for being here today. Your feedback really drives our work. So we want your feedback. Please take a few minutes and to let us know what you thought about today's presentation. So so you can scan this QR code now, right? I know you have your phone right next to you on your desk. So scan the QR code now. If you don't have time to do it now, you also will be sent as a follow-up a link to complete the survey. And then upon completion, you'll be redirected to get a certificate of completion as well. We really appreciate the impact and your choice to be here today to learn alongside the Youth Worker Wellbeing Project. Along with, so just to mention, you will receive a copy of the slide deck that was presented today. I also have included additional slides about the Youth Worker Wellbeing Project. So specifically related to telemedicine and virtual mental health services. So if you go through the presentation, you'll say, wait a minute, I didn't see those slides. You didn't see those slides, but they're at the end of the presentation. You can refer back to them later. So on behalf of IYI and the Youth Worker Wellbeing Project, thank you so much for showing up today and everything that you do for Indiana youth. We appreciate you. Have a great day.
Thanks.
Thank you.